Have you ever sat in a dentist's chair and wondered about the shiny metal tools they use? It can all seem a bit mysterious, can't it? Well, today we are going to pull back the curtain and talk about the most fundamental set of tools in any dental practice: the dental examination kit. This simple kit is like a dentist's first line of defense in keeping your teeth and gums healthy. It's the starting point for every checkup, every cleaning, and every dental journey. Think of it as the friendly welcoming committee for your mouth, helping your dentist get to know your smile and what it needs to stay bright and strong for years to come. It's the very foundation of good oral healthcare. A standard dental examination kit is usually made up of 3 key instruments. You've probably seen them before, laid out neatly on a tray next to the dental chair. These are the mouth mirror, the dental probe, which is sometimes called a sickle probe or explorer, and a pair of dental tweezers, also known as cotton forceps. Each one has a very specific and important job to do. Together, they form a team that allows your dentist to perform a thorough and detailed check of your entire mouth. Without this basic kit, it would be nearly impossible for a dentist to see, feel, and investigate all the hidden corners where problems might be starting to develop. The main purpose of this kit is simple: to help your dentist examine your teeth, gums, and the soft tissues of your mouth. It's all about investigation and discovery. Your dentist uses these tools to look for signs of tooth decay, gum disease, and other potential issues that you might not be able to see or feel yourself. It's a proactive approach to your health. By using these tools, your dentist can spot problems when they are very small and much easier to treat. This is why the dental examination kit is so essential. It helps prevent little issues from turning into big, painful, and often expensive problems down the road. So let's get ready to unlock the secrets of this amazing little toolkit. We will look at each instrument one by one, discovering what it does and why it's so vital for your oral health. Understanding these tools can help take the fear out of your dental visits and empower you to appreciate the incredible work your dental team does to protect your smile. It's not about scary gadgets, it's about precision instruments designed with your health and comfort in mind. By the end of our journey, you'll see the dental examination kit not as something to be nervous about, but as a true friend to your beautiful smile. Let's start with the tool you are probably most familiar with, the mouth mirror. It looks like a tiny, round mirror attached to a long, thin metal handle. Its design is simple, but its function is incredibly important. The primary job of the mouth mirror is to give your dentist a clear view of all the places in your mouth that are impossible to see directly. Think about the back of your front teeth or the chewing surfaces of your upper molars. Without the mirror, these areas would remain a complete mystery. It allows for indirect vision, reflecting the hidden surfaces so your dentist can inspect every single part of every single tooth. But the mouth mirror does more than just reflect images. It's a multi-talented tool. Your dentist can also use the smooth, rounded back of the mirror to gently move your tongue or cheek out of the way. This is called soft tissue retraction. It helps create a clear, unobstructed view of the teeth and gums they need to examine. This ensures that nothing is missed and that the dentist can work safely and efficiently without accidentally harming the soft, delicate tissues inside your mouth. This simple action is crucial for a thorough and comfortable examination for you, the patient. Another clever use for the mouth mirror is something called transillumination. This sounds complicated, but it's a really simple and smart technique. Your dentist can use the mirror to reflect the bright overhead dental light through your teeth. When the light shines through the tooth, it can reveal tiny cracks, fractures, or early signs of decay between the teeth that might not be visible otherwise. These problem areas will show up as dark shadows, giving your dentist an early warning signal. It's like having a special kind of X-ray vision, all thanks to a simple little mirror and a bright light. So, the humble mouth mirror is much more than just a looking glass. It is a vital diagnostic tool that provides vision, retracts tissue for a better view, and helps illuminate potential problems hidden from the naked eye. It's the first tool used in an exam because it guides the entire process, showing the dentist exactly where they need to look more closely with the other instruments. It truly is the window to your dental world, offering a complete picture of your oral health and ensuring that no corner of your smile is left unchecked or uncared for. Next up in our kit is the dental probe, which you might know as the Explorer. This instrument has a long handle and a sharp, pointed end that is often curved into a hook or sickle shape. Seeing this sharp point can sometimes make patients feel a bit nervous, but there's no need to worry. It is used with a very gentle touch and is an essential tool for feeling rather than seeing the condition of your teeth. Your dentist uses it to explore the surfaces of your teeth, checking for any tiny imperfections that could signal the beginning of a cavity. It's a tool of touch and texture. The primary job of the dental probe is to detect tooth decay, also known as caries. Healthy tooth enamel is one of the hardest substances in your body, and it feels smooth and solid. When decay starts, it softens the enamel. Your dentist will gently run the tip of the probe over the grooves and pits of your teeth. If the probe sticks or sinks into a soft spot, it's a clear sign that a cavity might be forming there. This allows the dentist to find decay at its earliest stage, often before it's even visible on an X-ray or to the naked eye, making treatment much simpler. The probe is also incredibly useful for checking the condition of existing dental work. If you have fillings, crowns, or bridges, your dentist will use the probe to trace the edges or margins where the dental work meets your natural tooth. They are checking for any gaps, ledges, or rough spots. An imperfect seal can allow bacteria and food particles to get trapped underneath, leading to new decay. By carefully feeling these margins with the probe, your dentist ensures that your dental restorations are still fitting perfectly and protecting your teeth as they should be, maintaining the longevity of the work. Finally, a special type of probe, called a periodontal probe, is used to measure the health of your gums. This probe has markings on it like a tiny ruler. Your dentist will gently insert it into the space between your tooth and your gum, which is called the gingival sulcus. In a healthy mouth, this pocket is usually only 1 to 3 millimeters deep. Deeper pockets can be a sign of gum disease or periodontitis. This simple measurement is one of the most important ways to monitor your gum health and catch problems before they lead to serious issues like bone and tooth loss. The final member of our trio of tools is the pair of dental tweezers, which are also commonly referred to as cotton forceps or college pliers. These look a bit like regular tweezers, but they are specially designed for use inside the mouth. They usually have angled, non-locking tips that allow for precise gripping and placement of small items. Their role might seem less direct than the mirror or the probe, but they are an indispensable helping hand that contributes significantly to the safety, efficiency, and cleanliness of a dental examination and many other procedures that might follow. One of the most common uses for dental tweezers is to handle small, sterile materials. For example, your dentist will use them to place and remove cotton rolls or pellets inside your mouth. These cotton products are used to keep areas of your mouth dry, which is essential for certain procedures, or to apply medication to a specific spot. Using tweezers instead of fingers prevents the transfer of germs and ensures that the sterile cotton stays clean right up until the moment it's used. This is a fundamental part of maintaining a hygienic environment during your checkup. The tweezers are also vital for retrieving small objects from the mouth safely. Imagine a tiny piece of a broken filling or a fragment of calculus, tartar, becomes dislodged during an examination or cleaning. It would be very difficult and unsafe for the dentist to try and pick it up with their gloved fingers. The precision tips of the dental tweezers allow them to grasp these small fragments securely and remove them from the mouth without any risk of the patient swallowing or inhaling them. This function is all about ensuring patient safety and maintaining a clear working area for the dental team. Furthermore, these tweezers are excellent for transferring items to and from the dental tray. During a procedure, the dental assistant might need to pass the dentist a small piece of gauze, a dental matrix band, or other tiny components. The tweezers make this transfer seamless and sterile. This helps the entire procedure flow smoothly and efficiently, reducing the time you need to spend in the dental chair. Their ability to handle small, delicate items with precision makes them an essential tool for organization and cleanliness, supporting the entire dental team in delivering high-quality care to every single patient. Now that we know the individual roles of the mouth mirror the dental probe and the tweezers, Let's see how they work together as a team during a typical dental checkup. Think of your dentist as a detective and the examination kit as their trusted set of tools for solving the mystery of your oral health. The investigation begins the moment you sit in the chair. The first tool out of the kit is always the mouth mirror. It's the scout, sent in to get a complete overview of the scene and map out the entire area of interest, your mouth. With the mouth mirror in one hand, the dentist begins a visual tour. They use the mirror to see the hidden surfaces behind your teeth and in the far corners of your mouth, looking for any obvious signs of trouble like discoloration, inflammation, or visible cavities. The mirror also gently retracts your cheeks and tongue, ensuring a clear and comprehensive view. This initial visual sweep allows the dentist to create a mental map and identify any specific areas that need a closer, more detailed investigation. It sets the stage for the next phase of the examination, guiding the detective to the clues. Next, the dental probe comes into play. While continuing to use the mirror for light and vision, the dentist picks up the probe to begin the tactile part of the investigation. They will gently trace the grooves on the chewing surfaces of your teeth and explore the spaces between them. They are feeling for the telltale softness or stickiness that indicates early decay, something the eye might have missed. They are also checking the margins of any existing fillings or crowns, ensuring they are still sealed and secure. This is where the detective work gets really detailed, using touch to confirm or deny the suspicions raised during the visual check. Throughout this entire process, the tweezers are on standby, ready to assist. If a small piece of plaque needs to be removed for a better view, the tweezers can do it. If a cotton roll is needed to keep an area dry for a clearer look with the mirror, the tweezers are used to place it precisely. They are the reliable assistant in this detective story, ensuring the investigation is clean, safe, and efficient. Together, these three simple tools work in perfect harmony, allowing your dentist to build a complete and accurate picture of your oral health, piece by piece, clue by clue, until the full story is revealed. For a dentist, the dental examination kit is more than just a set of tools. It's really an extension of their senses. It allows them to see, feel, and interact with the oral environment in a way that would be completely impossible with their eyes and hands alone. The precision and design of these instruments are what elevate a simple look inside the mouth to a professional diagnostic examination. The mouth mirror extends their vision, the probe extends their sense of touch, and the tweezers extend their reach and dexterity. Without this kit, a dentist's ability to accurately diagnose and plan treatments would be severely limited. The importance of these tools lies in their ability to facilitate early detection of dental diseases. Problems like cavities and gum disease often start silently, with no pain or visible signs that a patient would notice at home. The probe can find a tiny spot of decay long before it becomes a large, painful hole. The periodontal probe can measure gum pockets and detect the early stages of gum disease before it leads to irreversible bone loss. This early detection is the cornerstone of modern preventative dentistry. It allows dentists to intervene with simpler, less invasive, and less expensive treatments, saving the patient from more complex procedures in the future. Furthermore, this basic kit is fundamental for creating accurate and detailed patient records. During an examination, the dentist will chart their findings, noting which teeth have fillings, which have signs of decay, the depths of gum pockets, and any other abnormalities. This meticulous record-keeping, made possible by the detailed information gathered with the kit, is essential for tracking a patient's oral health over time. It allows the dentist to monitor slow-developing issues, assess the success of past treatments, and make informed decisions about future care. It's the foundation for a long-term, personalized healthcare plan for your smile. Finally, the dental examination kit is a universal language among dental professionals. Whether a dentist is in London, New York, or Tokyo, the basic examination kit and the techniques for using it are virtually the same. This standardization ensures a consistent and high level of care for patients everywhere. It also facilitates clear communication between different dentists or specialists who may be involved in a patient's care. When a dentist documents findings gathered with these standard tools, Another dentist can easily understand the patient's history and current condition, ensuring a seamless continuation of care. It's a simple but powerful element of global healthcare. From a patient's point of view, understanding the purpose of the dental examination kit can really transform the entire dental experience. For many people, the sight of metal instruments can cause anxiety or fear. However, knowing that each tool has a specific helpful job can be very reassuring. Realizing that the sharp-looking probe is used with a feather-light touch to find problems before they hurt, or that the mirror is just there to help the dentist see, can demystify the process. This knowledge empowers you as a patient, turning a potentially stressful situation into an understandable and collaborative health checkup. The most significant benefit of the dental examination kit for you, the patient, is the preservation of your natural teeth and overall health. When your dentist uses these tools to find a small cavity early, it can often be treated with a simple, small filling. If that same cavity were left undiscovered, it could grow, leading to a painful toothache, the need for a much larger filling, a root canal treatment, or even the loss of the tooth. The kit is your smile's early warning system, helping you keep your own teeth for a lifetime and avoiding more invasive and costly dental work. The examination process also provides you with valuable, personalized feedback about your own oral hygiene routine. As your dentist examines your mouth, they might point out areas where plaque is accumulating, which they can see clearly with the mirror and probe. They might say something like, "I'm noticing a bit of buildup on the inside of your lower front teeth." This is not a criticism, it's helpful guidance. It shows you exactly where you might need to focus more when you are brushing and flossing at home. It makes you an active partner in your own dental care, armed with specific information to improve your health. Ultimately, the use of the dental examination kit is a sign of high-quality, thorough care. When you see your dentist meticulously checking each tooth with their mirror and probe, it should give you confidence that you are in good hands. It shows that they are committed to being proactive and preventative, rather than just waiting for problems to appear. A thorough examination with this basic kit is the foundation of a trusting relationship between you and your dental team. It demonstrates a shared goal, to keep your smile healthy, comfortable, and bright for many years to come, and that is a truly comforting thought. Let's look at some simple, real-world examples of dental problems that are commonly discovered using the examination kit. One of the most frequent findings is dental caries, or tooth decay. Your dentist might use the mouth mirror and see a small dark shadow on the chewing surface of a molar. To confirm, they will gently touch the area with the dental probe. If the tip of the probe sinks into a soft, sticky spot, that's a positive confirmation of active decay. This tiny discovery, which might be completely painless for you, means the decay can be removed and a small filling placed, preventing the cavity from destroying more of the tooth. Another common issue found with the kit is calculus, also known as tartar. Calculus is hardened plaque that cannot be removed with a toothbrush at home. Using the mirror for a clear view, the dentist or hygienist can spot yellow or brown deposits, often near the gum line, especially behind the lower front teeth. They can then use the dental probe or a scaler to feel the rough texture of the calculus. Identifying these deposits is the first step toward removing them during a professional cleaning, which is crucial for preventing gum inflammation or gingivitis, the first stage of gum disease. The kit is also essential for identifying problems with existing dental work. Imagine you have a silver amalgam filling that has been in your mouth for many years. Using the sharp tip of the dental probe, your dentist will carefully trace the margin where the filling meets your tooth. They might feel a tiny ditch or gap that has formed over time as the filling has worn down. This is called an open margin. This small gap is a perfect trap for bacteria and can lead to new decay forming underneath the old filling. Finding this allows the dentist to recommend replacing the filling before more damage occurs. Finally, the periodontal probe within the kit is a hero for detecting gum disease. As the dentist gently walks the probe around each tooth, they might call out numbers like 2, 2, 3, 2, 5, 2. The 5 indicates a 5 mm pocket between the tooth and gum. This is a clear sign that gum disease has progressed beyond simple gingivitis and is starting to affect the bone that supports the tooth. This discovery, which you would not be able to feel yourself, prompts a discussion about more intensive cleaning, deep cleaning, and improved home care to stop the disease from getting worse and to save your teeth. In our journey today, we have demystified the 3 core instruments that make up the standard dental examination kit. We've seen that the mouth mirror is not just for looking, but for illuminating and retracting. We have learned that the sharp-looking dental probe is a tool of delicate touch, a detective searching for the earliest signs of trouble. And we've discovered that the humble tweezers are the unsung heroes of safety and cleanliness. Each tool, though simple in its design, plays a critical and irreplaceable role in the comprehensive care of your mouth, working together in perfect harmony. This toolkit is the very heart of preventative dentistry. Its greatest strength lies in its ability to facilitate the early detection of dental problems. By allowing your dentist to find cavities when they are just tiny specks, to spot gum disease before it causes irreversible damage, and to check that your existing dental work is still doing its job, the examination kit saves you from pain, complex procedures, and expense. It empowers your dentist to be a proactive guardian of your health, rather than just a reactive fixer of problems. This approach is fundamental to modern healthcare and to keeping your natural smile for life. Understanding what these tools do helps to bridge the gap between patient and provider. It can reduce dental anxiety by replacing fear of the unknown with knowledge and confidence. When you understand that every instrument is designed with your health and safety in mind, the dental chair becomes a much less intimidating place. It allows you to see your dental checkup not as an ordeal to be endured, but as a positive, collaborative step you are taking to invest in your long-term well-being. It makes you an active and informed participant in your own healthcare journey. So the next time you settle into the dental chair and see that neat tray of shiny instruments, you can look at it with a new sense of appreciation. This simple, elegant, and incredibly effective dental examination kit is not something to fear. It is your smile's best friend and most dedicated protector. It is the first and most important step in a partnership between you and your dental team, working together to ensure your smile stays healthy, happy, and bright for all the years to come. It is, without a doubt, one of the most important toolkits in all of healthcare. But what does the future hold for the humble dental examination kit? As technology advances, so does the potential for even more precise, comfortable, and effective dental care. Imagine a world where your dentist's toolkit includes not only the classic mirror, probe, and tweezers, but also digital innovations designed to make your visits faster, friendlier, and more informative. Already we're seeing the rise of intraoral cameras, tiny, high-definition devices that allow both dentist and patient to see crystal-clear images of every corner of the mouth on a screen. These tools help catch problems even earlier and allow you to see exactly what your dentist sees, making your care even more transparent. 3D dental scanners are starting to replace traditional molds, making the process of fitting crowns or orthodontics quicker and far more comfortable. And smart probes, equipped with sensors, are emerging to help measure things like gum health and plaque buildup with incredible accuracy. Looking ahead, artificial intelligence promises to revolutionize dental diagnostics, helping dentists spot patterns and potential issues that might be invisible to the naked eye. Even the materials of tomorrow's tools are changing, becoming lighter, safer, and more environmentally friendly. While the core principles of care will always remain, these new technologies are set to make dental visits less intimidating, more interactive, and even more effective. The dental examination kit of the future isn't just about tools. It's about empowering you and your dentist to work together for a lifetime of healthy smiles. So as you think about the simple kit that protects your smile today, remember, the future is bright, and the next chapter in dental care is just beginning. Taking care of your dental examination kit at home is just as important as using it. With a few simple habits, you can keep your tools clean, safe, and ready for every use. First, always rinse your tools under warm running water right after you use them. This helps remove any debris and keeps your kit fresh. For a deeper clean, soak your tools in a solution of mild soap and water, or use a bit of hydrogen peroxide for extra germ-fighting power. Just be sure to rinse them thoroughly and dry with a clean towel to prevent rust or water spots. Next, store your kit in a dry, closed container, preferably one that's easy to clean. This keeps your tools protected from dust, moisture, and accidental drops. Avoid leaving them loose in a drawer or bathroom counter where they can collect germs or get damaged. And don't forget, dental tools aren't meant to last forever. Check regularly for signs of wear, like dull edges or loose handles. If you notice any bending, rust, or damage, it's time for a replacement. Keeping your kit in top shape means safer and more effective care for your smile. By cleaning, storing, and replacing your tools as needed, you're not just maintaining your kit, you're investing in your health. With a little attention and care, your dental examination kit can be a trusted partner in your daily routine, helping you protect your smile.